There is nothing called depression. You are just finding excuses for not doing your homework. One mother kept telling this to her daughter. Let us find out more. Welcome to Mindscape Matters, a channel to discuss mental health and more. I am Dr. Monraj. I am a consultant psychiatrist based in Chennai, and I'll be your guide as we discuss different facets of mental health. The daughter, who was in college, kept telling her parents that she was feeling sad. She told them that she had lost interest in whatever she had to do, and she was not able to enjoy anything which she was able to enjoy earlier. She also told them that she has been getting suicidal ideas for the past 2 months. Her parents kept telling her that it was nothing and she would be fine soon. As she persisted with her complaints and wanted them to take her to a psychiatrist, mother told her that there was nothing called depression and she was just finding an excuse to avoid her homework. Those who have depression need no proof for depression. They are aware of their suffering and they know that something needs to be done about it. Many parents are capable of reading subtle emotional changes in their children without even the child telling them. But there are some parents who are not able to read their children's emotions. Worse, they do not see it even after the child tells them about feeling sad. A sad statistics from my practice is when children or adolescents are brought for consultation, the consultation is initiated by either the child or adolescent or by the parents. When children initiate the consultation, it's invariably for an emotional problem like anxiety, depression, or obsession. When parents initiate the consultation, it's invariably for a scholastic problem like he's not taking good marks, or he's not studying well, or for a behavioral problem like he's breaking things, he's spending long time on the internet. Parents not recognizing emotional problems in children could be due to many reasons. One could be their lack of awareness about mental health issues. Second could be their dogmatic view that depression as an entity does not exist. Another could be the stigma about depression. What will others say if we seek treatment for depression? The best way out is to deny depression as a whole. Now, coming back to our story, the girl persisted and finally made her parents bring her to me. I talked to her and she had features of severe depression. She also has been having suicidal ideas. After talking to her, I took her permission and then I spoke to her parents in her presence. I told them that she has severe depression and has to be started on treatment. The mother immediately responded, "Oh, she managed to cheat you also." I said, "You do not trust your daughter when she says that she is depressed and is suicidal. And you do not trust a psychiatrist who has evaluated your daughter when I tell you the diagnosis. What more can I do to make you accept that she is suffering?" The mother promptly replied, "Is there a blood test for depression?" Depression is an emotion and can be felt by the person. Others can sense it by observing the person's appearance, behavior, speech, mood, and thoughts, and also by listening to the person narrating what they are going through internally. Many of us can sense depression in a relative or a friend because of the change depression brings on in their body posture, body language, speech, and behavior. A diagnosis of depression is made by a psychiatrist both by observation of all these things and also by talking to the person about their mood and thoughts. In the past, there were attempts to have a lab test for diagnosing depression, probably to convince the skeptics. These are biochemical changes which could give indirect evidence that there is depression. We call them as a biomarker. In my opinion, this is a waste of time as skeptics are not going to believe in biomarkers. When COVID tests are available, there are still many people in many countries who did not believe that COVID is real and who continue to proclaim that COVID was a hoax. Leave alone depression. Let's come to the most common symptom in any doctor's clinic. Let it be a family physician, orthopedician, opthal ENT specialist, or any other specialist. What is the common symptom that you hear in these clinics? You are right. Pain is the most common symptom that you will keep hearing. Headache, neck pain, back pain, joint pain, stomach, eye, ear pain, etc. Does pain have a blood test or a scan or any other investigation to prove that pain is there? No. We believe the patient when they say that there is pain, and we also believe about the severity of pain. Sometimes a patient rushes to the casualty with stomach pain. All the investigations show that there is no abnormality. Ultrasound is normal, MRI is normal, blood biochemistry is normal. They look for enzymes to rule out pancreatitis. Everything is normal. What do? The surgeons take the patient for surgery for what is called as exploratory laparotomy. They open up the abdomen and explore to see whether there is any abnormality. That is the amount of importance given to the patient's word when they say they have pain. Let us look at another example. When ex-ministers are arrested, when do they get arrested? On a Friday evening, because Saturday and Sundays are holidays and you can apply for a bail only on a Monday morning. What happens to the ex-minister when he is arrested? He promptly develops chest pain, and instead of going to jail, he will go to a 5-star hospital. The chest pain will last until the bail is obtained. And if he has Mediclaim insurance, the insurance company will even cover his hospital expenses without asking about the validity of the pain. But when a person with depression claims Mediclaim insurance, the company asks about the validity of the diagnosis of depression. Now, what happened to the mother and daughter in our story? The mother agreed to start treatment reluctantly. The daughter improved. Gradually she improved, and as soon as the daughter became completely all right, they dropped out. I hope she's doing well. If we cultivate empathy and are able to feel and recognize others' emotional states, we will not need a blood test. We would know that they are depressed even before they tell us. Thank you for watching this video. If you liked this, please tell 4 of your friends. Tell them there is a Tamil version also available. Stay tuned because Mindscape matters. Bye.